Hey everyone, thanks for stopping at our e-poster. This presentation is titled Viewpoints Investigating the Prevalence and Practices of Herbal Medicine Use in Antenatal Care in Mukono District, Uganda, a cross-sectional study. I'm Mackenzie,
And I'm Payden.
and we're both fourth-year medical students. You can see on the slide our entire poster, but don't worry, we'll break it down for you on the subsequent slides.
So starting with our overview and relevance, our objective was to describe herbal medicine practices in pregnant women seeking antenatal care at the Mukono District Health Center 4 in Uganda, and to determine how traditional birth attendants recommend herbal medicine use in pregnancy. Herbal medicine use is incredibly common during pregnancy in low and middle income countries, and the services of traditional birth attendants are also commonly utilized. However, the safety of many herbs remains unclear and understudied. This study is a branch of a previous study done in Mukono District that assessed a variety of antenatal care practices. The midwives interviewed in that study desired much more research regarding herbal medicine use, as they were seeing it cause complications such as parasites in their own patients. You can see where the district center is located in the map, as well as some photos from the clinic below.
So this study was IRB approved through both UWSMPH as well as the Uganda National Council for Science and Technology. There were two parts of the study, the first one being a 17-question questionnaire that included both open and closed-ended questions asking all about different medication uses during pregnancy. We allowed women to openly name what they use, when they use it, and for what reasons they use it, as well as where they obtain these medications from. And this included both Western medicine as well as herbal medicine. You can see in the picture on the right in the top, this is a tent that was set up at the health center. And under this tent is where we interviewed women. The second part of the study were two key informant interviews with traditional birth attendants who were recommended to us by the principal health officer. Um, we were able to ask these traditional birth attendants all sorts of questions about what they do for pregnant women when they come to see them, what services they offer, what they recommend as far as herbal medicine use goes, how they prepare and distribute those medications. You can see in the bottom three pictures, this is outlining the process of making a mumbwa, which is a common herbal medicine, by mixing the herbs with clay, shaping the clay, and then putting it in the fire for preparation.
Moving on to our findings, you can see the demographics of our interviewees to the left. Most of our respondents reported using herbal or traditional medicines during pregnancy. Most women got these herbs from family members, local gardens, TBAs, or friends, and over 46 total herbs were reported, with the most common herbs being bombo, imumbwa, nariembe, kayayana, and oweza. The graph is broken down below by the reasons that these women reported taking the herbs. TBAs also emphasize that herbal medicine is a part of a strong cultural tradition.
We were able to ask women what if they strongly agreed through strongly disagreed on various things regarding antenatal care and medication use during pregnancy. And overwhelmingly, the vast majority of women thought that attending antenatal care during pregnancy was important, that taking herbs during pregnancy was important, and a good majority also thought that seeing a TBA during pregnancy was important. And so while the exact herbs and reasons for using these varied among respondents, we know that it was very culturally important that they were using these herbs. Now, they cited many different reasons for using them, including breaking, which is softening the bones or opening the pelvic floor for or the birth canal for birth of a fetus, blessings, energy, power, strength, disease prevention, and much more. So there's a cultural emphasis on seeing a TBA, not just for those herbal medicine uses, but for things like figuring out the positioning of the baby, helping with postpartum hemorrhages, preventing things such as malaria or anemia, including also some cultural diseases. And so you can see pictures on the bottom of preparations of these herbs, as well as them all packaged and prepared ready for selling. And future studies should include research on the safety of these herbs, as well as incorporating the knowledge of this traditional herbal medicine into Western medicine practices. Thank you for viewing our poster, and we hope to answer questions virtually.